The HSS Brachial Plexus Center, I think, is novel in a number of ways. We have a huge team of specialists, multidisciplinary, and we work closely together. And that's particularly important because these problems are so complicated and require so many aspects of care. You really need a multidisciplinary team that not only can take care of the patient, but really work together and understand each other.
An integral part of our care is rehabilitation. And we are blessed to have a tremendous rehabilitation center here at Special Surgery. The extent of our rehabilitation services is second to none. That is a really critical part of a patient's recovery. Because now you have someone who's seeing someone not once every 6 weeks or 3 months, but someone who's seeing a person 2 or 3 times a week, who, while they're doing their therapy, they're also evaluating all those other psychosocial aspects of their lives and helping them get through that and helping them really understand what they need and tailoring the treatment to what they have and what they need. And that interchange, that dialogue between the surgeon, the patient, and the therapist is a critical part of treatment and recovery.
The team approach is so important because these injuries are incredibly complex. They're complex from a medical standpoint, from a surgical standpoint. They're complex from a social standpoint, family standpoint. So we got Zoe Landers into our team.
I think that there is actually a very strong correlation between one's mental health and one's ability to recover. And if I'm not mistaken, there's quite a bit of literature around that. Because if we think about it, if you're actually depressed, it's a lot harder to get out of bed, to do the things that you need to do. Going to the appointments, following up on the exercises, really being an active participant in one's therapy, as well as addressing day-to-day activities of living. Because if you're depressed, you're not really doing that. You're not practicing the different things. You're not really seeing where your growth is in terms of your rehabilitation. Most of the patients have really enjoyed being able to speak with me because nobody asks them how they're doing. They're asking about the injury, but not them as a complete person. And it's been really nice for them to have someone with whom to speak about the tiny little nitty-gritty details.
When I see a patient now and I know there's going to be bad news, I'm ready to follow that up with that there's more help. And you can see the patient, their attitude changes, they just brighten up, and they're just very grateful that there's more help.